So I'll go ahead and introduce our speaker, Melissa Allen. She is a registered mental health counseling intern, exercise in medicine, fitness professional, and board certified lifestyle medicine professional. She founded her own coaching and consultation company, Mind Body Thrive Lifestyle, providing evidence based therapeutic lifestyle solutions driven by a background that spans biology, clinical psychology, and animal training. Melissa is known for her experience in mindful based stress reduction, positive psychology interventions, and behavior change coaching using mindfulness, motivational interviewing, cognitive behavioral therapy, and acceptance and commitment therapy. She is passionate about the interconnectedness of physical, mental, and emotional well being and helping individuals implement transformative, sustainable change. She is an esteemed member of the Lake Nona Performance Club Medical Advisory Council, serves as secretary for the American College of Lifestyle Medicine's Fitness in Medicine member interest group, and currently works full-time as a clinician well-being coach at Orlando Health. Melissa, thank you for joining this collaboration between MHCCF, La Amistad, and UBC. We are excited for you to share about your passion in working with clinician wellness and resilience. So we're ready to hear from you about using lifestyle medicine and positive psychology interventions to promote clinician well-being. Take it away.
All right. Thank you so much. I'm so happy to be here with everyone this morning. And while this presentation was planned kind of before the last few weeks events unfolded with the COVID-19 Delta variant exploding over our state of Florida, this presentation couldn't be more timely because while we've gone through the first wave of COVID, we took our best care that we could to stay resilient during those times. And for us to be getting towards that point where we could see the light at the end of the tunnel and begin to start seeing life start to take on a sense of normalcy again, only to have ourselves set back even further from this crisis that we've been dealing with. And so one of the things that I love about lifestyle medicine is that when everything else feels out of control, lifestyle medicine gives you something that you can control. And that's the choices that we make and the actions that we take to promote our well-being. A lot of times it's easier said than done because many of these things we already know. We know we should be doing so many of these different things for our health, but oftentimes we run into barriers to behavior change. And so that's what we're going to talk a little bit about today. I'll go ahead and start sharing my screen. Here we go. All right, if you're playing a virtual meeting bingo, I'm going to give you a first square. Can everybody see the screen? Thumbs up. All right, wonderful. Thank you so much. Okay, so let's go ahead and start talking about how we can use lifestyle medicine and positive psychology interventions to promote our own well-being as clinicians. First, disclosures to make. I do have my own company, as was mentioned in the introduction, but I have no other financial disclosures to make. A little bit more about myself. I did graduate from the University of Central Florida back in 2012 with my bachelor's in both biology and psychology, and returned for my master's in clinical psychology in 2018. So I did graduate in August amongst the last peak of COVID. So it was a virtual graduation, which, as you can imagine, was pretty interesting to go through. Other things, I have a dog that is certified therapy dog. His name is Buddy. He's actually sleeping back behind me here. I was gonna say, let me see if I can get a little, yeah, there he is. So he's hanging with us today.
So cute.
And then I am a former animal trainer. So between my undergraduate and graduate career, I was working with a lot of different species of animals. And I do want to acknowledge the fact that I do have privileges as a cisgender, heterosexual, white female. To start today, I would first of all like to extend my gratitude for each of you for taking this time out of your day to share in this virtual space to learn more about promoting our well-being as clinicians. This is a necessity, not a luxury, for us to practice self-care on a regular basis. And so as we get started with our presentation today, if you feel comfortable doing so, I would invite you to participate in this mini meditation with me, focused on self-compassion. So if you'd like to participate, I invite you to find a nice, comfortable seated position, preferably wakeful with a nice tall spine, softening the shoulders away from the ears. And if you feel comfortable doing so, allowing the eyes to close softly. And just taking a moment to acknowledge that you're making this effort to become the best version of yourself that you can, to honor all of the difficulties and challenges that we faced throughout the last 18 months, feels like a little longer, and recognizing that you have experienced anything from loss to burnout to your own health challenges potentially, and allowing yourself to feel all the feels around that. And if you'd like, placing one or both hands over your heart space and just taking a moment to notice that you're here right now. Taking a couple nice, slow, deep inhales and exhales. Inviting yourself to bring in self-compassion as we go through this presentation together. And honoring that each and every person's experience is unique. And as you feel ready, gently beginning to allow the eyes to close softly. And thank you for allowing me to guide you through that brief meditation practice before we move on. So just a quick overview for today. We're going to be defining what lifestyle medicine and positive psychology are. We'll have a quick discussion in the chat about what are some of the challenges that we face for practicing professional self-care, whether it's in our environments, in the behaviors that hold us back, or anything that might get in the way from us being able to prioritize our own well-being as caregivers. We'll do a very brief overview of the research that's starting to emerge related to how these interventions can be protective factors against burnout and even potentially facilitate recovery from burnout as well. And last but not least, we'll end with a personal well-being assessment. So if you didn't have the time, if you would like to print out the handout that was sent attached in the email for this meeting, that's the personal wellness assessment that we'll be doing, but I'll also share my screen so that way if you want, you can just kind of write your answers along the way as well. We'll only take a couple minutes for that before we close today.
Also, Melissa, yeah. I put it in the chat for everybody.
Oh, wonderful. Thank you so much. Yes,
that's very
helpful. All right, excellent. So our learning objectives that we're focusing on today are explaining the 6 pillars of lifestyle medicine, identifying how these interventions can protect us from burnout and promote our well-being, and then being able to conduct that personal well-being assessment and reflecting on some of the ways that you might be able to incorporate what we're learning today into your own well-being plan. So really quickly, there are usually a couple things that come up through these presentations that I just like to take a moment to acknowledge. This presentation, while we tend to underutilize some of the behavioral interventions that I'll be discussing today, this is by no means an anti-medication presentation. Medications, of course, have their place in treatment. The day and age that we are living in right now, sometimes those medications get overprescribed when we could be potentially using therapeutic lifestyle interventions. So that's that myth busted. When we get to the nutrition section, this is not telling you that you should be going vegan or vegetarian. It's just about eating more plants for our health. This is also not intended to be medical advice. I am not your doctor. I am not a doctor. And so make sure that you always consult your physician before making any drastic lifestyle changes. And last but not least, as I mentioned in our meditation, please meet yourself where you're at right now without that harsh, critical inner voice that we tend to have. That's all the shoulds and all the times that we failed at trying to change our lives. And we'll discuss why that's very important a little bit later too. So our first objective, what is lifestyle medicine and what are the 6 pillars behind lifestyle medicine for promoting well-being? I really like to share this cartoon. The Awkward Yeti is one of my favorite profiles to follow because they share such great content, but this one in particular as it relates to lifestyle change. So we have our brain and our heart. The heart says, we did it, a full day of making better choices. And our brain says, yep. Heart says, or brain says, ready for day 2. Heart goes, day 2. Brain, yes, this is a long-term thing. Heart says, oh, like 3 days? So oftentimes that can be reflective of our own personal journeys where we might have all of this motivation built up and we're so disciplined for the first few hours, days, weeks, months of our health journey. And then we end up hitting a roadblock that can set us back. And so being able to recognize that this is a journey and recognizing that setbacks are going to happen, and then figuring out with a growth mindset approach, what is the best way that we can recover from that setback to keep ourselves from falling into that same pattern in the future. So looking at our failures as learning opportunities. So to define lifestyle medicine, this is the definition that's taken from the American College of Lifestyle Medicine and the International Association of Lifestyle Medicine. So lifestyle medicine is the use of evidence-based therapeutic lifestyle interventions. It introduces the 6 pillars here, but we want to use it as a primary modality delivered by clinicians trained and certified in this specialty, so there's standardization, to prevent, treat, and often reverse chronic disease. So the reason this conversation is so important is because my generation in particular is the first generation in which our lifespans and longevity are predicted to be shorter than the generations before us. So for the first time in human history, our lifespan is taking a downward trend. A lot of it is attributed to the ways that we're living. We're more sedentary. We're eating processed foods that aren't nutrient. They're full of sugars and all these empty calories that don't fuel our body. And so not only that, we're more stressed than ever. And I think this pandemic has more than highlighted that. And it's all of these things that come together. We're more isolated. We're having to connect through technology. The social media feeds are starting to impact our mental well-being at earlier and earlier ages. And not only that, the technology is being engineered to become addictive. So all of these factors coming together are really having a significant impact on not only our well-being, but also the generations to come. So for such a time as this, we are called to recognize what are those things that are holding us back, that are detrimental to our health, and how can we beat the system? Because honestly, the healthy choice is not really the easy choice right now. We really have to work and make an effort to promote our optimal health. And that's why it makes lifestyle change so difficult, because we're constantly fighting against foods that are engineered to be addictive and sedentary lifestyles attributed to the fact that we have a plethora of our favorite shows on all of these streaming devices where we can watch entire seasons in one sitting. All of those things are where we feel comfortable. They're things that are easy for us to do, but at what cost? So we have to start recognizing what are the ways that I'm living right now that are impacting my overall well-being, mental, physical, emotional, spiritual, financial, occupational, taking all of those life areas and more into consideration. So let's move on to, if I can find my cursor here, there we go, the 6 pillars of lifestyle medicine. So the first one, like I mentioned, is nutrition. The whole food plant-based diet is what we call the North Star. So it's kind of that guiding principle of optimal nutrition. Now, this is where people tend to get caught up because they might think, oh, you're telling me to go vegan or vegetarian. Not necessarily. We're just telling you to eat less animal products and eat more plants. So the animal products like red meats, processed meats, they actually fall under, this surprised me when I first learned about it, but they fall under the class 1 carcinogen category, according to the American Cancer Society. So that class 1 carcinogen also includes alcohol and tobacco. So the meats that we're consuming are, and oops, if everyone could just take a moment to make sure that they're muted. I was gonna say, I hear someone's very cute child in the background. So when we're consuming more and more of these animal products that cause internal stress to our bodies, and we're not getting the nutrients that we need from these plant foods that aren't processed, it takes an impact on our health. And that's when we might have to start taking supplements. And that's why when we might have to, really start to focus on the foods that we're eating and how they affect us. Because there are some foods that may be anti-inflammatory for some people, and they may cause inflammation in other people. So really finding that nutrition journey is going to be very unique for each and every person. Some people may have conditions that keep them from eating certain types of foods. So really just being mindful of each of our bodies. There's not a one size fits all approach to nutrition, but the more that you can start using that whole food, plant-based eating style as your North Star, the more health benefits that you're going to start seeing over time. And I can personally speak to this one because I grew up in Texas where barbecue is a food group of its own. So as I started to learn more about lifestyle medicine, this was the one that I had the biggest hang up with. And I was so hesitant and skeptical until I started recognizing that if this is something that I want to pursue as a career, I really need to give this a try. I really need to go all in and see how this works. And I can tell you, the more that I started transitioning from a meat heavy and a dairy heavy diet, and alternatively had more plants in my diet, I did start noticing health differences. I started losing weight. My cholesterol got a lot lower because high cholesterol runs in my family. My blood pressure got better. And I ended up having, ladies, you might relate to this, but I was at the point that I had precancerous cervical cells. And my doctor said, okay, we have to go through surgery to remove these. So had them removed. And a few months later, they were back again. And so again, I felt like my health was out of my control. So what else could I do? And at that point, that's when I made the decision to transition to a mostly whole food plant-based diet. Did I exclude everything else that I love? No, absolutely not. But by making that transition to where it was maybe 90% whole food plant-based that I was eating, the precancerous cells disappeared and my doctor was blown away. So part of the reason for that is the red meats, the processed meats, the dairy products, they cause inflammation in our body, and virus cells feed off of inflammation. So that's why it's important to really start recognizing and tuning into how what you're eating affects your body. Do you feel bloated? Are you gassy afterwards? Do you even feel pain in your joints at times? So starting to just recognize and eat mindfully instead of just eating to eat. Because I don't know about you, that's one of the barriers that I tend to face is if I'm running around throughout my workday, I don't even have the time or the space to dedicate to my meals. I'm eating on the go. And so then I'm not even thinking about what I'm putting in my body. I just say, I need some energy. But the more that we can pay attention to how we're fueling our bodies, the more that we can start reaping those health benefits over time. The next one is sleep. And oftentimes we recognize that sleep is very important. but it may sometimes be the first thing that we sacrifice along the way when we have a lot to get done. But making healthy sleep a part of your normal routine is crucial to our health, because sleep is where our brains and our bodies are able to restore and replenish our energy resources and repair any damage that has happened along the way. So for healthy sleep habits, try to make sure that your room is like a cave where it's quiet, cool, and dark. For adults ages 18 to 65, aiming for about 7 to 9 hours of sleep per night. And with our screen time, we want to make sure that we're avoiding those blue lights. So all of those blue wavelengths can end up interrupting our sleep wake cycle. So making sure that you either have some blue light blockers if you're working late at night, or just avoiding laptops, phones, TVs in general about 30 minutes to an hour before you start getting ready to go to bed. And making sure that we're getting sunlight during the day too. If you're stuck in your office all day and it doesn't have a window, try to find those pockets of time to take yourself outside for even just a couple minutes, because that exposure to daylight is what is also helpful in kind of maintaining our circadian rhythm to help us start to feel sleepier as the day goes on when the sun begins to set. Next is exercise. We all know that this is an important one for us, but one of the things that I notice holds people back from exercising is their conceptualization of exercise. Any sort of movement is going to be good for your mind and your body. So you don't have to do an intense 60-minute high intensity interval training session to get the benefits of movement. Just try to find even like a 5 to 10 minute pocket per day that you can get moving, whether that's walking, if that's having like a dance break between your sessions. Doing something that you enjoy moving your body to is also another key component in making regular physical activity part of your routine. We may get intimidated by the national recommendations for physical activity, which are 150 to 300 minutes per week of moderate intensity activity. So if you break that down, that's about 30 to 60 minutes, 5 times a week. If you're not doing any sort of physical activity, that itself is going to sound extremely overwhelming. So you may even quit before you get started. So really trying to scale that back and just focus on what can you do to add more activity into your day without getting stuck on the shoulds, the what should I be doing? The alternate to that is if we're doing vigorous intensity activity, it's going to be 75 to 150 minutes per week, which is still around 30 minutes 5 times a week. And so being able to recognize that if you're living a totally sedentary lifestyle right now, which I don't know about you, but since quarantine, I've been a lot more sedentary than I ever have been in my life. So being able to recognize and have that awareness of how long have I been sitting for? When was the last time I moved my body? And being able to be mindful about that throughout your day. Another recommendation is having 2 days of resistance training or strength training per week, but making sure that those days are non-consecutive. Because what happens when we're strength training is that even when we're doing body weight resistance, or if we're lifting any kind of weights, the muscles are getting micro tears in them as you're doing your contractions, as you're lifting and fighting against that resistance. And so what we have to do is we have to allow those micro tears to heal. And that's what's going to help lengthen and strengthen our muscles over time. So we don't want to have leg day 2 days in a row, because those muscles are just going to break down even more since they have no time to repair. And that's when you could potentially get injured. So making sure that you have a dedicated space between your strength training days. But if you do want to have back to back, making sure that you're working different muscle groups. So you don't want to work, again, those same muscle groups on consecutive days. Try to have a little bit more of a mix up between that. Substance abuse. So we want to avoid risky substances like tobacco, like illicit drugs. We only want to use prescription medications as they're prescribed. And for alcohol, this one tends to be the tough one, because alcohol has become so normalized in our society. It's involved in every aspect of socialization that we typically see on TV or in advertisements. And so alcohol is kind of the new smoking because it is still a class 1 carcinogen. So any amount of alcohol that you're consuming is increasing your risk of certain types of cancers like esophageal cancer, liver cancer, pancreatic, for women, breast cancer. So trying to be mindful of what those moderate to low risk drinking guidelines are. So recognizing and actually pouring yourself a standard size drink whenever you go out somewhere. And if you're having an alcoholic drink, then trying to recognize what is the measurement of the pour that they're giving you, because some places will be very heavy handed with the alcohol that they're serving, and trying to recognize that for women, 1 or less standard drink per 24 hours is the low risk drinking guideline. And that's that's 7 or less drinks per week. For men, it's 2 or less. And so standard drink sizes, we have a 12-ounce beer, which is about 5% alcohol. So now that craft beer is becoming more and more of a commonality around us, recognizing that the different alcohol percentages may be higher. So it could potentially be 1.5 or even 2 standard drink sizes for beer. For wine, it's a 5-ounce glass of around 12% alcohol. And then for liquors, it's 1.5 ounces of distilled spirits, which is around 40% alcohol. So if you're not drinking, the recommended guidelines are don't start. And that's coming from the CDC, the American Heart Association, the American Cancer Society, because alcohol is becoming so much more alcohol consumption is becoming so much more attributed to different lifestyle related diseases. Now, alcohol is typically used as a coping mechanism for our next one, which is stress management. So we need to try to find more adaptive coping skills for our stress management strategies. And that could involve cultivating a growth mindset. So the growth versus the fixed mindset, where fixed mindset thinking is all of the I can't, I won't, I'll never, I'm a failure, all of those things that are very rigid thought patterns. And trying to expand those to be more flexible, including that growth mindset to including yet, I can't do this yet, or I may have failed this time, but what can I learn from this so that I don't repeat that same pattern next time? Building stress resiliency, so practicing regular stress management strategies, whether that's mindfully drinking a cup of coffee, whether it's petting your dog, trying to find those micro moments of stress management throughout the day. Because if we only focus on relieving the stress that we're experiencing when we go on vacation, we're not really going to get the most benefits out of that, right? Because we have all that stress building up in between that's going minimally managed, I'll say, because chances are you're still managing it in between, but it's building up over time. And then you have your vacation and you decompress and you relax, but then vacation's over and then you're back at it again and it's just building up. So we need to try to find those ways to manage our chronic stress by taking time outs, by practicing a mindful minute. So just taking 60 seconds to deep breathe throughout your day. And practicing regular stress management also helps with what I tend to call amygdala hijacking. So if we can cope with when we flip our lid, right? Because our frontal lobe is where we make all of our logical decisions, and we have our sound judgments that are made from this space. It's our most evolved part of the brain. Whenever we experience a state of emotional arousal, what tends to happen is we flip our lid. So this frontal part of our brain goes offline and the amygdala is what takes over. And as we know, the amygdala is our emotion powerhouse. So whenever we get hijacked by our amygdala and we're acting out of space, we're acting out of a space of emotional reactivity, we need to find ways to recognize, first of all, like, whoop, okay, I'm being taken over by my emotions right now. And then find those strategies that you can practice to bring yourself back online, back into a place where instead of reacting out of emotion, you're able to respond from a place of sound and logical judgment calls. All right. And our last pillar of lifestyle medicine is social connection. So, building positive social connections and strengthening current positive social connections that we have. So, whether that's joining different interest groups or volunteering for a cause that's important to you, attending community events, all of those things can be beneficial to our health. Obviously, the challenge that we've all faced over the last 18 months is having to do this virtually. And even though we're not all sharing in the same space, still being able to connect and feel each other's energy through the screen by seeing each other's faces and having the smiles that are shared and the eye contact through the screen, that can still have benefits to our health. It's not to the same degree as it would be if we were all sharing in the same space with each other, as much as I wish that this would have been how we were having this meeting. But being able to even have micro moments of social connectivity throughout the day. So some of the research that has come out, obviously with the masks, we're a little bit limited in our facial expressions, but even just those moments of eye contact with the smiling with the eyes is enough to find some of those physiological benefits that would be coming from in-person and extensive social connection. All right, I'm going to pause here to see if there's any questions so far. All right, I don't see anything in the chat, so I'll keep moving on. All right, our next objective is, again, reviewing how lifestyle medicine and positive psychology can help act as an antidote to burnout. Not just burnout, but any sort of difficulty that we're facing that's impacting our well-being. So it could be building your resilience to face maybe some of the current health challenges that you're going through. It could be enhancing your well-being so that you can withstand all of these different difficulties that COVID is throwing at you between interacting with your patients in a different way through a virtual platform, not having your coworkers around if you're working from home and you used to be able to share that space and have that social connectivity between your sessions. And life just looks a lot different these days. So finding those ways that we can control where our focus and energy are being channeled into the behaviors that we make through our lives. So the first thing that I want to distinguish is kind of talking a little bit about burnout, where stress and burnout sometimes get used interchangeably, but ultimately what it boils down to is that stress is too much and burnout is not enough. So if you look at the symptoms that are listed here, it talks about stress having over engagement. You're emotionally overreactive. You have hyperactivity. Whereas burnout is kind of the other way around. Burnout is almost like a sense of numbness. The things that once lit you up, you're starting to notice that you have a very flat affect towards, if any sort of emotion towards it. And those are the times in which we have to take that step back and really start to examine like what's happening here, what's contributing to this right now. And if you are in that space, just knowing and having hope that you can heal from that. It doesn't mean that you have to abandon your counseling career, but you may have to take a step back to start to see where you can find those pockets that you can dedicate your time and energy towards healing through this. So burnout kind of has three different constellation of like groups of symptoms that typically come up in the research. And so while it isn't a DSM diagnosis, it has been included in the World Health Organization's ICD-11. It's not a medical condition, but it's an occupational syndrome. And unfortunately, burnout is not just from the individual level. A lot of times it's very multifaceted and it can have enormous influences from organizational structure. So one of the things that I always try to share is that if you are experiencing burnout, it's not entirely your fault, especially given the circumstances that we're living in the world right now. We've had so much to manage in our own personal lives. The clients that you're seeing are coming to you sharing probably the same anxieties and concerns that you are also having related to COVID-19. And there's just so many things happening all at once that, again, all of those things might feel out of your control at times. So as it relates to conceptualizing burnout, we have feelings of energy depletion or exhaustion. You are just running on empty. Maybe you're even running on fumes at this point. And as much as you try to practice self-care, you can't even find the energy to do that. The other constellation of symptoms is reduced professional efficacy. So making it not making it, it ends up becoming the feeling that you're not as effective in your role. You have a lower sense of accomplishment in what you're doing. And then the last thing is that depersonalization, right? You may start to have a sense of cynicism around your job where you were once energetic and empathetic and compassionate. Those might be depleted or even non-existent if you're facing burnout. And one of the studies that really captured my attention was this one that I'm sharing the quote from: with job demands outnumbering job positives, mental health practitioners are at an increased risk of facing burnout during COVID-19. And I don't know about you, but that definitely resonates with me as we've been trying to care for people while we care for ourselves, but it keeps getting harder and harder because of everything that's going on around us in the world. Last year, we were facing the different social justice issues that were coming up. This year, we're having the different issues with what's happening over in Afghanistan starting to happen. We're also having the issue of people butting heads and being divided against the vaccinations. And all of that comes together and affects our well-being. So what can we do about it? And this is where combining lifestyle medicine and positive psychology interventions can be very, very effective. And more of the research is starting to show that. Unfortunately, what's happened is that the literature is very heavy with a focus on physician well-being and resilience and burnout. And so these articles that I'm sharing today and the information that is coming from these articles have a very heavy focus on physicians, not necessarily healthcare providers in general. But I truly do believe that based on what I've been seeing working in my roles, but also what I've experienced personally, that these interventions can help us start to transform not only the healthcare system in general, but also how we approach our own health and well-being. Oftentimes people that I've worked with in the past have said, oh, well, this runs in my family, or, you know, I'll always have XYZ condition because, you know, so-and-so relative had it. But ultimately, for any type of lifestyle related disease, so this could be hypertension, it could be obesity, type 2 diabetes, one of my cardiovascular disease. Wow, that one just kind of slipped my mind. I'm still working on my coffee this morning too, y'all. But with those types of lifestyle related diseases, like I mentioned at the beginning of the presentation, the way that our society is starting to live as a whole is making us sicker over time. So being able to recognize where are the ways that we can regain that control over our health. Because yes, we can't change our entire genetic makeup to have us be the healthiest person alive, but there are ways that we can regain that control over our health. And that's where lifestyle medicine can be very beneficial. But before we move on, I did want to share this definition of positive psychology because it is evidence-based, and it's really about focusing on your strengths and focusing on finding your purpose, your meaning, and having your focus stay there. Because positive psychology isn't about saying everything's sunshine and rainbows, life is great no matter what's happening, but it's about finding what's important to you in your life, really identifying those values, also finding your character strengths and figuring out how you can use those to move in a direction of your values, and starting to focus and retrain your brain to find the positive amidst all of the negatives. I like to call it finding the pearls after the storms, right? Because sometimes with the ocean, whenever the big storms roll through, they can actually uncover some of those treasures like pearls. So trying to find the positive amongst the challenges that are inevitable in life. So coming back to how this relates to burnout, I just wanted to throw this up there with a different constellation of symptoms and how for the energy depletion and exhaustion, lifestyle medicine can be helpful for that, because if we're able to develop and build healthy habits that support our well-being, it's going to help increase our energy resources. Not to say that change is going to happen overnight, but when we do good for our brains and our bodies and we feel good, that is going to give us a revitalized sense of energy. For the depersonalization from positive psychology, if we can find that engagement in what we're doing and the meaning and purpose behind what it is that we're doing, and really try to focus on those aspects of our jobs versus some of the things that might come up as we get more irritable, that start to bother us when maybe they wouldn't have bothered us before, all of this was happening, and really trying to maintain your focus on why you do what you do. Why did you decide to get into this field in the first place? And reminding yourself of that over and over again. And then the last one, for the reduced professional efficacy, being able to focus on the feelings of good that you get from your successful client interactions, from the ways that they compliment you or have shared that they help you. One of the things that I found helpful is that I will kind of create like a little love letter bank for myself, because when our brains are set to default to the negative, we could be going through a job interview and have 30 glowing reviews, and then there's that one person that says, I didn't really like them. Which is the one that you're going to focus on the most? It's going to be that one because it bothers you. And that's where our brains are just naturally wired to find the threat, right? To fixate on those negatives. So we have to retrain our brains to expand and focus on all of these good things that are happening, because some of the negative things, they're bound to happen. They're going to happen. And try not to take those personally, and also focus on the things that are filling your cup, the ways that you are feeling successful and that make you proud of what you do and give you that sense of accomplishment. We don't want to be minimizing our jobs because we do amazing and transformational work. So the brief overview of the research that I wanted to just share is how therapeutic lifestyle interventions can enhance our overall well-being. And one of my favorite articles is based on this project called the LIFT Project that was created by Dr. Darren Morton. And he is out in Australia, and he's a big proponent of lifestyle medicine and has been creating this comprehensive and integrated model that uses lifestyle medicine principles and positive psychology interventions to promote overall well-being. And so some of his favorite taglines that I love that just really stuck with me was that motion creates emotion. So when we're moving our bodies, making sure that we're focusing on the feel-good hormones that come up, right? Those endorphins that start pumping, even as we're walking out in nature, or as we're finishing a strength session, or as we're in Shavasana after a yoga session. So really starting to channel your focus on the ways that you feel good as you're moving your body. We kind of discussed already about how food feeds mood. So if we're eating more highly processed foods, or foods that I like to call our crap foods, where they're calorie rich and processed. So those really nutrient dense foods, or I'm sorry, the calorie dense foods that don't have a lot of nutrients, those are the crap foods that cause inflammation in our bodies and can invoke more stress into our bodies, as well as it tries to process those foods and digest them. We talked about how sleep is important, so rest to feel best, also incorporating the stress management principles in there as well. And a recent article that came out talks about, again, physician resilience, but I like to think that can expand to any healthcare provider. So healthy lifestyle behaviors are key elements of resilience. So making sure that we're functioning at our optimal and peak performance so that we can show up as our best selves for the people that we are working with. So for the current health of healthcare professionals, as much as we are helping people kind of work through their own health and well-being journey, sometimes it comes at our own cost because we may be prioritizing taking care of everyone else that we're forgetting to invest in our own self-care. And so overall, the rates of burnout are starting to climb for healthcare providers, along with the risk of lifestyle related chronic diseases. And what that can lead to is that if you have a client coming into you that is talking about how they're depressed and they're not exercising, but that could be a potential solution for them. If you're not exercising yourself, you're less inclined to explore that area with this client because it's going to cause cognitive dissonance, right? We know that exercise can help relieve depressive symptoms, but if you're not exercising yourself, then you're less likely to counsel your patients on those types of behaviors as well. So I mentioned in the beginning of this presentation about how when we're judgmental and critical towards ourselves on our own lifestyle journeys, it tends to lead to relapses over and over again. If you end up, breaking and having a treat day, you may throw away all of your progress and say, oh, well, I messed up this once, I might as well just quit. I know that has happened to me so many times. I can't even count how many times that has happened throughout my lifetime. But since I started recognizing that the more we focus on how our healthy lifestyle behaviors make us feel good, the more inclined we are to do them. So if you're sitting there and you have a salad and you're eating your salad and all you're thinking about is the salad doesn't taste good, I can't believe I'm having to eat this, I'd much rather be having a hot dog, that's not going to really help you make that into a sustainable lifestyle change. You may do it for the time being, especially if you have a goal that you're working towards. Maybe it's a finite time that you're working on this goal. But after that finite time, then what happens? We tend to go back to what we were doing and we lose out on all that progress and say, see, it didn't work. And so then we just continue living the way that we're used to. So when it comes to making sustainable and long-term lifestyle change, we have to recognize the ways that we're sabotaging ourselves through negative self-talk and work on building and fostering more of that compassionate self-talk. So we want to minimize that inner critic voice that we have that's just beating us up. I like to call it our inner drill sergeant. I don't know if that resonates with anyone, but that's how it feels sometimes. Or the inner mean girl voice, that movie Mean Girls, I feel like I have Regina George in my head sometimes that, just really beats myself up over certain things. But really trying to find a way to build that more compassionate voice that says, I know you're upset at yourself that you didn't eat according to the way that you had hoped to, that you didn't get your exercise session in. But you know what? You've done really well so far and you're still trying. So don't give up because you've already done such an amazing job and you can continue learning and growing through this experience. And that type of approach is going to be much more sustainable over time because it feels good. It feels a lot better than beating yourself up. If you can become your own cheerleader and support yourself through this, then that is where that ultimate transformation is going to take place. So that kind of relates to what the research is starting to refer to as this upward spiral theory, right? Because there tends to be this reciprocation of if we're doing good for our brains and our bodies, we're going to feel really good too. And as we start to feel really good, we're more inclined to do more good for ourselves. So it starts to create this upward spiral of change instead of that downward spiral where you're beating yourself up and doing all of those self-sabotaging behaviors where you're emotionally eating, you're drinking yourself to the point that you just want to forget about everything that's happening. So instead, we can flip that script So getting rid of the inner drill sergeant voice, or doing your best not to get hooked to that voice, right? So trying to create that space to recognize the voice and say, oh, there's my inner drill sergeant again. Okay, what would my cheerleader voice be saying to me right now? That compassionate cheerleader that really wants to see me succeed. And then again, moving into improving our own health and happiness, being able to recognize that these approaches give us control over our health behaviors. So when everything else feels out of control, these are some of the things that we can control for ourselves. So some of the most prevalent interventions from positive psychology that are those tangible ways that we can increase those feel good emotions and experiences are gratitude, acts of kindness, mindfulness, and then the PERMA model. So for the PERMA model, those key positive emotions would be gratitude, but also forgiveness, hope, and optimism. So really trying to find more of those within your life. Engagement is that state of flow, that when you get lost in an activity because you're so engaged in what it is that you're doing, you're so engrossed in that activity that you just lose track of time. And relationships, which we've discussed, but particularly those positive social connections. Those are so important for our happiness, our physical health, and our longevity, because not only do they have that emotional impact on us, but those relationships also have physiological benefits to our health. Meaning, which is associated with productivity and success in the work that we do, that life fulfillment where you are just living in your purpose each and every day. And it can also lower our risk of cognitive decline and disability and improve our longevity. So the more that we feel like we have meaning and purpose in life, the more that we're expected to have longer lives to live. And last but not least, accomplishment. So that's associated with our own self-esteem, our self-confidence, self-efficacy, and how determined we can be to overcome obstacles. All right, wonderful. So let me go ahead and check chat really quick. Oh my goodness, y'all have been engaging so much. I love it. Thank you so much for this. Yes. Oh, this is a good question. So mentioning enjoying a cup of coffee as a way to relax. Where does caffeine stand in lifestyle psychology? Is it as harmless to include in our daily lives or the lives of patients and clients that we serve? Yeah, that's a fantastic question, because caffeine, it is an addictive substance. And we want to make sure that we're either moderating or eliminating based on whatever you feel called to do. There's no place in particular that it fits into the lifestyle medicine besides the substance abuse, because if you are overindulging on caffeine, that can have impacts in your well-being in terms of impairing your sleep. It can make you more anxious, right? Because caffeine is a stimulant. And so just making sure that, again, you're listening to your body, because for some people, 1 cup of caffeine or 1 cup of coffee may give them the jitters all day. For another person, they might be able to go to sleep right after that cup of coffee. So it really depends on the person. There's no kind of standard guideline for that. Great question, though. Working in community mental health in the past was also hard on past burnout. I wasn't trained early on to care for the self. Yes. Oh, Beliza, this is such a good point. Yes. In our training, depending on your program, they may not mention self-care at all, because it's more of the just, grin and bear it type thing. Or, if you can't handle this, then maybe you're not cut out to be a clinician. But then there's other programs that really recognize that you are doing your clients a massive disservice if you are not taking care of yourself. And so for the programs that we missed out on that training early on, sometimes we have to take a more reactive approach where we recognize that we hit burnout and now we have to recover from it. Yeah, Linda, interesting about the caffeine, the coffee and grapes have the pesticides. Yeah, so maybe just recognizing where these are coming from, where they're sourced, and being mindful of that. Mm-hmm. Yes, absolutely. Oh, so the CRAP foods. So that was an acronym for calorie rich and processed. So kind of the flip side of the whole food plant-based, right? Those calorie-rich foods are going to be the ones that are nutrient poor. So calorie-rich and processed. All right, wonderful. Well, I know we're coming to the end of the presentation. So what we're going to do next is the wellness wheel assessment, but I just had to share this quote here from one of the research articles because it speaks to what we've been talking about through this entire presentation, how it is important that healthcare professionals prioritize their own health, not only to provide safe and effective patient care, but also for their own well-being. Because if we're burnt out, our quality of care is likely going to decline. And that might lead us to make mistakes where we overlook important things that our clients are telling us. And so we really have to be functioning at our best so that we can then provide the highest quality care. Okay, wonderful. Let's go ahead and take this moment to walk through the wellness assessment. So I'm going to switch over to my other screen so that way I can kind of walk through this with you and describe it along the way. All right, here we go. So the paving wheel to wellness. This is a really fun tool because I don't know if you've done wellness wheels with your clients in the past, but oftentimes it might not be as informative because it's just based on a self-report from people kind of evaluating where they feel they're at in different areas of their wellness. So this is the paving steps wellness assessment, and it's an acronym that goes all the way around paving, getting down here, steps. So it covers lifestyle medicine, but also positive psychology. And the instructions are listed on the page if you do have it printed out, and gives you an example of how to chart the different wellness web based on the points that you get in the following assessment. Now, the lower the score doesn't mean that you're doing anything bad in that area. It's just to inform you based on some of the recommendations where you're falling in that comparison with those guidelines. So it's not good or bad. It's just where you may have been paying less attention to that can inform you on areas that you might want to start paying more attention to. And so as we get into, I'm trying to move my little Zoom thing here so that way I can. Yep, there we go. Okay, wonderful. So this is the assessment that you walk through, and you'll notice at the top, the instructions, you'll rank each row on a scale of 1 to 5. 1 being never do this, all the way up to 5, doing this regularly as part of my routine. So you would read the first row and say, I exercise 5 days in the week for about half an hour. Do you 1, rarely do this or never do this? 2, only rarely do this. 3, sometimes. 4, often. 5, it's regularly part of your routine. So you'll go through and you'll score each of the 5 rows on that scale of 1 to 5. So it's not trying to prioritize the rows. You go each one, 1 to 5, 1 to 5, 1 to 5. And then you'll notice there's a section at the bottom for your total in that module. So that total score there is where you're going to plot on the line here. So let's say I had a 15 for physical activity. That is where I would plot my line. So I'll give you a couple moments to go through this on your own. I will leave this up in case you don't have it printed in front of you, so that way you can still see it. A couple of the ones that usually bring question is I tend to eat a rainbow of colors on my plates, or I try to have a rainbow of colors on my plate. That's just referring to the actual colors of the food that is taking up space on your plate. So is it a more diverse representation of colors on your plate, or is it kind of falling in a very stale palette on your plate? Again, it's not good or bad, just informing you where your attention is at. The next one that usually comes up is I perform mini experiments on myself regularly. That just means trying new things. That just means paying attention to new experiences. So that one tends to get people. And then under the energy, it says I only drink 2 cups of coffee a day. So if you don't drink any coffee at all, then it really should be phrased as I only drink 2 or less cups of coffee a day. So then if you drink no coffee, you would rate this as a 5. Do this regularly as part of my routine. Because it's, again, getting at that, we don't want to be too caffeinated in our day. All right, I see some questions popping up in the chat. All right, wonderful. Okay. Yes, there we go. So yes, it was linked in the chat. Okay, excellent. So just take a few moments to walk yourself through this. Don't try to overthink on each of the scores. Just try to, you know, not spend too much time over analyzing it. You're not getting graded on this.
Hello.
Hi, who's there? Oh, never mind. I thought someone had a question. I want to be mindful of your time, so we'll take another minute or two before we wrap up our presentation.
Can you explain what practicing enhancing my resiliency to stress means?
Basically, that just boils down to regularly practicing stress management. So how much are you practicing different stress management strategies to build your resiliency to stress?
All right, so it's not when you're stressed, it's just practicing them.
Yes, yes, absolutely. Good question.
Hi, thank you so much for your presentation. Are you sharing your PowerPoint with us?
I can send it to Giselle or Gisela, so
Thank
that
you.
way she can share it. I know I forgot to attach it when I sent the original handout.
Thank you.
Yeah, of course.
Yes, we can probably attach it to the website of MHCCF.
Perfect. Thank you so much. All right, so if you're not finished with the assessment, don't worry. I just wanted to share this as a tool for all of you to be able to find a way to focus on where is a habit that you want to begin building in for your own positive health journey, and how are you going to make time for that? So creating a goal for yourself based off of this assessment on one way that you can focus on your well-being and promoting your overall positive health. So when you're setting that goal, just a couple reminders, try to make sure that it's positively framed. So if, for example, you want to drink less soda, instead of saying, I'm never going to drink soda again, or I'm only going to drink X number of sodas per week, try to focus on, I'm going to drink more water, because we want to focus on what we're adding more into our lives to benefit us versus what we're focusing on restricting ourselves with or taking out of our lives. Also make it a SMART goal. So specific, measurable, action-oriented, realistic, and timed. There's a couple different interpretations, but that's my favorite version of the SMART goal. Also start small with just one behavior at a time. Habits are really difficult to change, and so don't overwhelm yourself. Find accountability, because as we know, social support is key, and try to make sure that it's a process focused goal instead of an outcome focused goal. So an outcome focused goal would be, I want to lose 20 pounds. A process focused goal would be, I want to start increasing my physical activity by walking 3 days a week for 30 minutes. So there you go. Wonderful. I appreciate all of you so much for being here today. Thank you for taking this time to share in your Friday morning with me. And here's my list of references that I will keep in the slides whenever they get posted on the website. And here's how you can get in touch with me. Thank you
Thank
all
you
so very
much, Melissa. We really appreciate, and these are just such important tips. I know we all learned a lot from you this morning, so we appreciate you sharing your expertise with all of us. And just wanted to thank you all on behalf of the mental health counselors of Central Florida, and of course us, UBC. We provide detox, substance use rehab, as well as mental health inpatient for children, adolescents, and adults. And we take every insurance, just about, Medicaid and Medicare included. And then Melissa is representing La Amistad. Did you have a few things you wanted to say as well, Melissa Alvarez?
I don't see myself. Hi, there you are. There I am. Yeah, we're residential inpatient for adolescents and adults age 12 and up, and we're going to be offering a new program beginning in October for virtual IOP for first responders. So I just wanted to get the word out on that, and we'll have more information, and the reps that are assigned to the Central Florida market will be marketing that as well. So and I appreciate joining the call and meeting all of you. I'm usually based in the Tampa market, so it's wonderful to meet everybody and meet some new faces. So thank you for allowing us to be part of this today.
Thanks, Melissa. I appreciate it. Makes it easy. There are two Melissas from La Amistad.
Yeah.
Also, if you're wanting CE credit today, you want to complete the post-presentation feedback from mental health counselors of Central Florida, and they welcome all feedback on the survey. Live participants will need to complete the post-presentation feedback form by the end of the month, so keep that in mind. And then the on-demand video and feedback form will be available on the website after the start of next month. And the website is mhccf.com. If you have any questions about CEUs, please feel free to reach out to Summer Katz. She's the Education and CE Chair, and she's just fabulous and wonderful, and gave us a little script to go by today because she could not be here. So she is definitely missed as well. Her email is ce@mhccf.com in case you need it. I'll put it, oh, it's already at Jaleesa. You're so great. She has it in the chat already. And with that, it is so lovely to see all your smiling faces. Be safe, be well this weekend, and take care of yourselves.